Our motto is right patient, admitted under the right team, into the right ward at the right time.
I can see how many ambulances are at the hospital at the moment, how many are on their way, how long they've been there.
If we can see the data, how can it impact our service and how can we change and improve?
It gives you live and accurate feedback at any one time, and we can make decisions based on good current information rather than retrospectively.
The Coordination Hub is an operational command centre that has looked at getting the right people in the room who have an impact on the patient journey from pre-hospital in through the emergency departments, admissions through the hospital, and then discharges from our service.
So the Coordination Hub is going to help patients from the start of their journey to the end of their journey.
The Coordination Hub is built using an agile product. Using the SystemView MyHub application, we can actually transform the platform using production-grade analytics really easily. This helps us to deal with niche situations.
The back end of the hospital is just as important as the front end. We need to know how many discharges we've got. What's great with SystemView is that the information is really easy to read. It's colour-coded, and the graphical information really makes it easy for staff to be able to make decisions in relation to patient flow.
So currently we've got two ambulances on their way to Robina and 2 on their way to university.
We can actually look at lead indicators that predict what might happen later in the day. And that helps us to design what actions we need to put in place. But most importantly, because the data is trended, we can actually see whether our actions make the problem better or worse. So we can track that as we go. It's incredibly useful.
If you look at this screen now, you can see at any one time how many patients we've got in the ED waiting for those beds. And these are all waiting for subspecialty reviews.
We work with the bed managers of the 2 hospitals, and that gives us, again, the ability to know what's coming in, know how the hospitals are sitting, and manage how many ambulances are arriving at one point at one hospital.
So the partnership with ambulance service has been really important in how we actually manage flow, both from an ambulance perspective, the emergency department, but then as a health service altogether.
We get real-time access to data, but also real-time access to hospital management. So when we're having an issue that we need to manage at the moment, in the moment, and really get action taken, we can coordinate with online managers through QAS, but also hospital management to facilitate what we need to happen.
The Coordination Hub has unleashed the potential within Gold Coast Health through the visualisation and information sharing, the opportunity to realise that innovation is not a bad thing, and that the ability to share information, the responsibility is shared, and so it's a whole organisation approach to how we manage flow.